Dr. Raj, your friendly Beverly Hills orthopedic surgeon who treats sports injuries and joint pain. I'm here to protect you from yourself and keep you out of the operating room. Weekend warrior injuries. Weekend warrior injuries will kill you quickly or may cause pain and suffering for the rest of your life. Sounds extreme, doesn't it? But it's real. As an orthopedic surgeon, I see this all the time. I see these simple injuries that actually dictate people's lives, destroy their careers, put them in a hospital, make them gain weight, make them develop diabetes, heart issues at an early age, make them addicted to medications, opiates, from a simple injury. Weekend warriors are all of us. Any age group. You can be 70 and be a weekend warrior. You can be 20 and be a weekend warrior. The whole concept is we all feel like we are kids. We all feel invincible. We have it in our mind, no matter what age group you are, that we could do what we did when we were 15. But guess what? As you age, two things happen. Our joints start wearing out. The cartilage, the bumper cushion, number one. Number two, our tendons start getting stiffer, meaning that we're more prone to tendon ruptures or tendonitis. That famous basketball star who's been playing for years and years on top of the whole world that we all know and love, especially in LA, Kobe Bryant, tore his Achilles tendon. That is a weekend warrior injury. That's a weekend warrior injury in an elite athlete. And that one injury dictated his whole career, changed his whole life. Instead of being a superstar elite athlete, now he's just a legend who's on the court. He's just a namesake right now. But that one injury, when I heard that pop, when I saw that game, I knew it. The reason being is you don't have to be someone who's sedentary, who doesn't work out, and suddenly go out and do an activity and sustain a weekend warrior injury. You can be a top athlete and not realize you're not conditioned to the level you should be at. You didn't do enough stretching, you didn't do enough pre-preparation with your trainer, and you could sustain this injury. And that's what happened with Kobe Bryant. It's the most extreme example. The difference with us is we may need to stretch for 20 minutes before our activity. The difference with Kobe is at the level he plays and the capacity he plays, he may have needed just a full-on physical therapy session before each game. Because he didn't do that, he sustained that injury. Because he sustained that injury, it has changed his career, and my Lakers aren't going to do so well for years to come. It's not going to be based on the legacy of Kobe Bryant. I have even one patient of mine, so simplistic. She's 26 years old. She's a nurse. Incredibly motivated person, but she used to work out 5 years ago. In her high heels at a club, was dancing, and she tore her ankle ligaments. To this day, when I see her, whenever she tries to wear high heels, her ankle gives out. She twists her ankle each and every time. It's almost a joke when you see it. She has stopped running. Now, mind you, she's only 26. But that 5 years ago, when you're 26, the hormones are working perfectly. Testosterone, growth hormone levels, your joints are preserved, your ligaments are nice and tight. But as you get older and you live this sedentary life where you don't want to work out, and you're not going to run or do whatever you have to do to take care of yourself, you'll start gaining weight. You'll start loading those ankles. You'll start having chronic pain. So I looked at her, and it's the first time. What happened was she was walking outside, and she was wearing high heels, and she was just completely. She was clumsy as anything. It was almost hilarious when you see what someone who's just every step she takes. And finally, I told her, take off those high heels. But in the end of the day, she doesn't want to take care of this. Her answer is not to run. So this weekend warrior injury changed her level, and she will get injured. She will gain weight. She'll overload that ankle. She'll have chronic pain. Her fate is determined now, especially with the fact that she's not taken care of this for 5 years. An injury left alone for 5 years doesn't get better overnight. Yes, you know that, and I know that. You need to take care of yourself. You know, she's in the invincible phase, but I can fast forward. I had the benefit of seeing people through all age groups, athletes, professional athletes, celebrities, the everyday person, the everyday warrior, the ex-football player, and I see what happens to them. And they all will cite, the funniest thing is each and every person, including this nurse, will cite the exact day they sustained that injury. She'll say, back in May of 2008, at this time, because that injury actually changed the fate of their whole life. I would love to hear your own stories in regards to that, because I know I can cite 2 different injuries that have changed my fate, 2 different injuries that changed my whole scenario in regards to activity. I personally used to be a pitcher. I would spend 4 to 5 hours a night and just pitching, and I loved baseball. There's no rush better than baseball. Injured my shoulder. Had to make a decision between pursuing baseball or med school, and of course, with an injured shoulder, I realized which way I had to go. But it's not to say, to this day, my shoulder kills me in terms of weightlifting. I know I have a labral tear. I know I have a tear, but again, I'm a weekend warrior, and I'm not listening to my own advice. I actually believe I have the Superman complex. I believe I'm invincible, but the day that my shoulder cracks and falls or dislocates out of place, then I'll be laughing at my own advice. But it goes to tell you, it's everyone. It's you. It's me. It's that nurse. We're all weekend warriors. And I would love, especially in the last 2 segments, to hear about that one injury that changed your whole life. Everyone has it. Everyone has an issue or an injury. But the whole point of this is acknowledgement that we're not invincible. We're all not Superman. We're all not the Peter Pan complex. We have to be on top of all of this, and we have to realize that there are things we can do to change our fates. And weekend warrior injuries, I mean, I believe this is the silent killer of the new millennium. Again, and there's a strong statement, but I see it. I see people who will say, this injury destroyed my life. This issue destroyed my life. I wish I would have stretched. I wish I would have warmed up. And because of this injury, I am set to where I'm at. Extreme? Yes. Real? Absolutely. This is coming from Dr. Raj in Beverly Hills. who sees a lot of these issues. This is Dr. Raj at the Lifestyle Talk Radio Network. I'm talking about weekend warriors, injuries, the silent killer of the new millennium. I would love to hear your stories, especially in the final two segments, of that one injury that changed your whole life. Stay tuned when we talk about the Olympics and how an injury in the Olympics, akin to a weekend warrior type of injury, may have changed the fate of a famous, well-known hockey player. This is Dr. Raj, Lifestyle Talk Radio Network. You can contact me at drhipandknee.com. Thank you.
Little Jack Horner said.